After delivering his policy address yesterday, Chief Executive John Lee attended a question and answer session at the Legislative Council today. Lawmakers have tried to seek clarity over Lee's proposed policy directions to buoy the city's economic development, including the northern metropolis and medical-related measures. A string of questions from lawmakers on Chief Executive John Lee's latest policy address. A key focus was the development directions for the northern metropolis. The city leader has proposed to establish a pilot industrial park in the metropolis to be managed and developed by a company set up and led by the government.
Given the current economic condition, how can you make sure the private sector will take part in this project? Will you consider a specific bill, say for Northern Metropolis bill, so that you could liberalize further the various restrictions and regulations? If we want to tap into market forces, there's already a good and successful example. That is, the airport authority is doing really well. How do we operate these various zones? It depends on the size and nature of the zone.
Another concern:
many people do not have a sense of belonging to the community. They are not taking an active part in public affairs. Are you worried that we don't have the right conditions for an inclusive society, and that may then stand in the way of our economic development? I've proposed a caring and inclusive society. That means everyone is involved. We have different views that we're able to make progress.
On the medical front, the government will set up interspecialty integrated outpatient clinics to avoid the need for multiple referrals. Some lawmakers questioned which specialties will be included, with various lengths of waiting time for different services. They include more than 180 weeks of waiting time for Kowloon West in ophthalmology.
We have finite resources. There could be coordination to make sure that the patient needs not go to different specialist clinics. Instead, the patient needs only go to one specialist clinic for consultation.
Speaking at a program jointly held by radio outlets, the CE also faced concerns over proposed regulations on subdivided units, which could lead to surging rents, possibly forcing the city's poorest to live on the streets. John Lee said the government will explore different ways to offer accommodation for them. On the medical sector's concerns over lowered liquor duties, the CE said only 15% of the city's imported liquor will benefit from that.